Grateful to our panelists who are joining us tonight to help kick off these important conversations. As we discussed at the first webinar, which was focused on civic engagement and advocacy, because of your generous support, Women in Philanthropy continues to grow, and we're now ready to explore new areas of impact for 2021 that supports the changing needs of women, girls, and their families in our region. Women in Philanthropy began in 2014 to help low to moderate women and girls and their families lift themselves out of poverty and disempowerment. Since then, with the extraordinary generosity of over 100 WIP supporters, we've been able to make critical strides in the lives of women and girls and their families in northeastern Pennsylvania. And in an effort to remain barrier breakers, we prioritize visionary, catalytical philanthropy to make regional change happen. And tonight's webinar will take a look at the state of affordable and accessible quality childcare for women in our community. There's a few important constructs that determine the viability of value of childcare. This would be affordability, availability, and quality. Pre-pandemic, there were already existing challenges to each of these three constructs, which have been considerably exacerbated by the COVID-19 pandemic. Lack of access to high-quality childcare can be a considerable barrier to equity for women in our community. Existing gaps to high-quality childcare prevent women from entering the workforce, force women to leave the workforce, and often disproportionately harm communities of color. Quality childcare is a social determinant of health, and it's a lever to foster future economic advancement. And these are likely several of the reasons why the supporters of Women in Philanthropy opted to explore possible areas of investment in childcare and to discuss how affordability, availability, and quality childcare has the ability to break barriers and create opportunity. And with that, I'd like to introduce our moderator and our panelists this evening. And remember, please feel free to put any questions that you have into the chat space or the Q&A space, and our moderator will integrate them throughout the discussion and at the end. Our session moderator tonight is Lisa Durkin. Lisa Durkin is a Women in Philanthropy supporter, and she serves as the President and Chief Executive Officer of the United Neighborhood Centers and the United Neighborhoods Community Development Corporation. At UNC, Lisa has served as the Housing Counselor, Director of Community Services, and the role of COO, where she developed an Education Department and Community Health Department. She's been actively involved in the Housing Coalition of Lackawanna County and Penn State Scranton's Advisory Board, and she's been named the NEPA Business Journal's Top 20 Under 40. Welcome, Lisa. Angela Siebert is employed with Outreach Center for Community Resources, where she served for 20 years. She served as program director, overseeing the agency's evidence-based parent, child, and family support programs. Prior to her time with Outreach, she's worked in recruitment and human resources. She's a longtime board member with Dress for Success Lackawanna. Linda Protisto, her career spans over 40 years addressing the needs of children, families, and communities, and she currently serves as the Early Learning Program Early Head Start Director with the Scranton Lackawanna Human Development Agency. She is a certified class observer, a certified trainer for the Family Development Credentialing Program, and a nationally certified Roma implementer. Leigh Miller is the Education Director at the Scranton YMCA. Prior to her current role, she served as the Pre-K Counts Director for Greater Valley YMCA. She's worked at summer camp programs and after-school programs in the public school system. Debbie Marichak is an administrator at Lackawanna County Department of Human Services, Office of Youth and Family Services, where she serves as the Educational Program Specialist and has served there for over 20 years. She supervises the department's school liaison units, the Arts Engaged program, and independent living, and she coordinates the Lackawanna County STARS Truancy program. And Peg Kopko. For over 25 years, Peg has worked as a funder, collaborator, and program developer while working in a community agency, most recently serving as the Vice President of Community Impact for the United Way of Lackawanna and Wayne counties. Prior to that, Peg provided direct service and counseling at Catholic Social Services. Now, these are abbreviated bios, so I had to condense them a little bit, but there's more more that these wonderful women in our panels have done. So I couldn't cover all of it, but what an exemplary panel we have tonight. We're thrilled that they're here to talk with us about childcare and their vast experience. And so with that, Lisa, I'll turn it over to you.
Laura, thank you for your kind introduction and allowing me to join you tonight. Coming from an agency that provides childcare services, this topic is very meaningful to me. And I think it's a very timely discussion for us to have. But like everyone else who's joined us tonight, I'm very anxious to hear from the panel. So we'll go ahead and get started. I have some specific questions for everybody, but I'd like to invite all of the panelists to weigh in at any time. Let me start with Angela. How significant is childcare as a barrier to families who are trying to lift themselves out of poverty?
Well, it can be a significant barrier. So at Outreach, we work with a majority of low-income families in our parenting and home visiting programs. And you know, it's especially a barrier when it's coupled with transportation, location, work shift hours, you know, and other variables that come into the picture. You know, a parent is looking for work and for childcare. You know, I think back to one of the families that I worked with many years ago when I was first at EOTC Outreach. And, you know, I think this mom is a good example of what all the things that have to happen. She lived in West Side. Her two little boys were in daycare in Center City, and she worked practically next door to the daycare. And all of those things were her little bubble, you know, she did not have transportation. So she was on foot with her two little guys. And her job was a minimum wage job, but she had been at it for a while and they treated her well and flexible with her when she needed time off. And so, you know, that kept her in, you know, in this tiny little bubble. And so it really took a lot of work and years for her to, you know, get out of that situation and save to buy a car and look for a different childcare, you know, and get herself another job that paid much better and that could be a family sustaining wage for her and her two sons. And so, you know, I think that just paints a little picture of what many of the families that we serve, you know, are looking at. So it's not just the one thing.
Safe to say, without childcare, that the parent that you worked with wouldn't have been successful.
Absolutely not. And you know, and she loved her childcare program, and that was another thing keeping her where she was. You know, so it was really difficult for her to get all the pieces together to move on, and she did it. And you know, her boys are grown now, but you know, we see those kinds of things every day. So.
And how easy it is to slip.
Yeah.
So you can't have any conversation in 2021 without asking, you know, how has COVID affected this? So Debbie, let me ask you, how has the pandemic affected childcare centers and options for families from your point of view?
Well, Lisa, thank you for having me. I appreciate being part of the panel this afternoon. And the pandemic has definitely affected childcare. What we've seen through the families that we work at the Office of Youth and Family Services, you know, there was reduced capacity in many of the childcare agencies, obviously due to the restrictions. If they were able to stay open, you know, some places had to close, but the ones that were open, obviously due to the restrictions, they had reduced capacity. And we also saw that the facilities were filling up quickly because with schools not being open, a lot of families had to resort to childcare for their children, and you know, then facilities were filling up and there weren't spots for children. So definitely with the reduced capacity and daycares filling up, you know, we saw that as an obstacle for some of our families struggling with childcare. Also, some of the facilities only had, half day, due to the pandemic. And if families required full day, then, parents had to struggle with, whether they were going to continue to work or stay home, and that's something that we've seen, also pre-pandemic, but I think it was definitely exacerbated with the pandemic, people having to choose to stay home as opposed to working, due to the limitations in childcare during the pandemic.
That's the logical conclusion. I think we saw that in a lot of the centers, the census counts lowering. Some of it we had facts on. We knew what decisions the parents were making. Other times we were guessing, and that's the logical conclusion. That they weren't able to get to work, or their hours were reduced, or their job was lost.
Right.
If I may add in, what we're seeing is also that, when childcare in centers is not available, what parents typically do is look toward a home-based type of care. And particularly during the pandemic, it's very convenient, much more convenient for them, lessens their worries, because very often you go with, when you're choosing childcare, you're looking for preferences. You're looking for a match in cultural values. You're looking for a match in terms of disciplining and what you think is important. And you're more likely to get that with people that you know. And in some cases, it's regulated care. In some cases, it is not. And I think typically what they're looking for is, some kind of confidence that the children are going to be cared for in a safe environment. And in the home, of course, there's less children in the space and provides for more safety. And they're talking also about, going more towards family as well when that's not available. That's typically what happens. You go with your family, and you're able to, if you have children of more than one age, have them all in one place, which is a very big issue with our families. They're in school districts, they're in a pre-K counts program, one child, the other child is somewhere else. And by the time you deal with transportation in some of these areas, it's not going to work. So it's important to have them in the same place or at least close. So I think typically what we're seeing is the pandemic has wreaked havoc on family systems, and everything has been upended. And people are needing to make different kinds of decisions, not always comfortable ones.
All valid points. And Linda, you listed a lot of pros for families who choose that option, to go with a small home-based care or a family. Debbie, I would imagine in your field, you see a lot of cons when families make that choice to choose a non-regulated childcare facility.
Sure. And I was thinking when Linda was talking too, it's definitely true. I think that, families also were making just personal decisions based on the fact of not wanting to, run the risk of, their child getting infected and bringing it home to their family. And especially if they have, high risk people in the home or, elders in the home. But what we also have seen, and we've, received referrals, I would say not as many as we thought we were going to get, but we definitely have received referrals of children being left alone that aren't age appropriate to be home alone due to the pandemic and them not having appropriate childcare. So that's definitely something we've seen, throughout this past year. And we've also seen where sometimes there are children who are, maybe older teenagers that are in the home, and then they're the primary caregiver because the parents are working for the younger kids during the day, but they're all on virtual school, so we've had many circumstances where there was just, issues that occurred in the home, with the siblings, with neglect or, fighting, and things would happen because, the older teenagers weren't prepared to be, caregivers, and had to be during this pandemic, and but also trying to keep up with do their own schoolwork, and but also being the caregivers to the younger kids in the home. So we've definitely seen an uptick in referrals due to kids being either home alone or home with older siblings, and that being definitely a factor in referrals for abuse and neglect.
So this has become really just one more nearly impossible decision for our vulnerable families to grapple with.
Yep, absolutely.
Linda, what are some of the other struggles that families face accessing childcare? Is it affordability, location, hours of operation?
We've touched on a lot of them already. Certainly parent work schedules is one of them, and what do you do during holidays? What do you do when your child is ill? What do you do, when you need some kind of backup care or weekend care in terms of your shift? There aren't a whole lot of options out there. I think too that parents of children with special needs have a especially difficult time finding the appropriate kind of care that they feel comfortable with. The staff is trained, to care for those children. We've seen a big hike in terms of children with behavioral issues in the past couple of years, and really severe types of issues. So you need that kind of training for sure to be able to work with those children in appropriate ways. We have some childcare deserts, what we call them, out there as well. That's where there are, few options for certain populations. Clearly in the rural areas, there's not a whole lot of choice out there, and whatever they do choose typically is a long way away. We see that with immigrant families where they're searching for some kind of match, with their culture, with their languages. Hispanic families especially have a difficult time. And I think too that, where they do find care, there's often waiting lists. So that's even more of a struggle for them. Just coincidentally, I was looking at something, and there is a group out there called Mamazonians. I don't know if you've heard of that, but it's a situation where Amazon is looking at helping some companies with backup care that's out there. So I thought that was pretty interesting. So it's such a big issue that the parents are getting together and trying to find some solutions for them. And I think that that's clearly the case locally as well. We also have the sick care issue, and people that now with the pandemic, especially, what do you do when one child can go to school and the other can't,
Miss work, probably.
Yeah. It's a real fragile childcare puzzle any way you look at it.
Well, that's a new term for me, Mamazonian.
Mamazonian.
I have to look it up. Angela, has that been your experience as well? All of the issues and then some?
Yeah, I will echo a lot of what Linda said. I think especially in a lot of cases, a lot of the families that we serve are entry-level workers. And so we're talking usually about folks that are working a second or a third shift. And, that makes it even tougher, right? To solve the childcare puzzle, as Linda just said. We had one situation recently where a single mom in one of our home visiting programs got a really nice third shift job offer. It was a decent wage. She had a really tough time finding overnight childcare for her baby, and she couldn't find something that was really going to be able to work for her. And so she wound up having to, pass up the job. And in another case, it was, Linda was talking about rural areas. We had a single dad who had lost his job at the beginning of the pandemic and was home with his two daughters who are a little older, like 10, 11. And so when he was ready to try to get back to work, he was having a devil of a time finding an appropriate child care for them. And, they were a little bit older, but still needed care. And he's in a little bit more of a rural area, and so his choices were very limited. So all of those things play into it. And I'll go back to the last question too, really briefly, and just say that one of our concerns has been too, some of these small childcare centers. I don't know that they're all going to make it or that they have made it. And I think that's another thing, that I know we've talked to families and they're concerned about that.
Sure.
It just lessens the choices.
Yeah, there's been a devastating loss of income across the board. Very difficult for them to carry on business. And attendance has really been very low. Yeah, even in the Head Start programs where, we have all the accommodations and supports, we have not seen a whole lot of, we're way below in our enrollment.
Leigh, what about from your perspective? What do you think, what factors do families consider when they're exploring childcare centers and trying to make the decision, where they want to send their most precious treasure?
I think the first thing they're really looking for is a place where they feel comfortable. They're looking for something that offers the hours that they're in need of, and they feel safe at, having the security where the kids are protected away from everyone else. Being in a YMCA, we're obviously with a lot of people within the building, and we have our area separated off from everyone else. So there is that security feature, and that's the level of comfort where they feel meet with the teachers. And COVID has obviously made that very difficult. Doing tours is not as simple as it used to be. It's by appointment only now. And a lot of families are not even coming in for tours because the spaces are so few for quality childcare. So they're kind of calling up and just taking any spots they can get.
Exactly.
And going based off of, word of mouth, which is probably one of the biggest factors now.
The reality is too that parents are making decisions really quickly with inadequate information and supports and a whole lot of worry. Simply because, as Angela pointed out, in some situations, you really need to take the job, or you'd like to take the job, but you don't have what you feel is comfortable, but having to go forward with that anyway. And I don't think that we can not take a whole lot of credence in the whole piece of choice. That's really important. And families of low income don't always have that choice. And when they do benefit from information such as child care resource and referral, to help them with some consumer education, what to look for, what kinds of questions to ask for, it makes that a little bit better. And of course, we have the QRIS rating system that also serves as some sort of education, some sort of information and communication about the quality of the provider that they're choosing.
Interesting. So I don't know that we've defined it as such, but really what I hear everybody talking about is the dignity component. That there's a dignity component to this. It's not just about, any old childcare, or as long as you could afford it, or if it's on your bus route. There's another factor, the dignity that it's your center of choice. It's the one where you feel comfortable with, and you can leave for work and feel a sense of security that your child is in the right hands. And that's an important piece to families.
Because Lisa, bottom line is you can't work if you're feeling uncomfortable or afraid of where your child is at.
Certainly.
Yeah.
And certainly every family and every child deserves the best care, right? The best care, the best education that they can get. So, yeah.
The peace of mind of knowing, they made the right decision or feel good about it. I agree. That's not too much to ask for. Peg, what do we know about childcare and early childhood education and its effect on a family's ability to break the poverty cycle?
Well, I would be remiss if I didn't talk about United Way Success by Six program. I mean, Debbie sits on it, and somebody from Outreach on it. We have somebody from Head Start on it. Megan from Head Start is on there. So we've worked very hard on that, and that's to ensure that every child enters school, to work with 0 to 6, every child enters school ready to learn. Because we're talking about, there's two pieces of this. You're talking about, and I really want to flip that dialogue from just childcare, which I want to use because that's the time I kind of grew up with all the time. But really, we want to say they're early education centers, because that's what the child is getting in those days to prepare them to go to school. So there's a cute little video I'd have to look up that's called like the zip code lottery. And it's really where Johnny lives in a certain area, and he's so many steps behind, Mary, who maybe lives in a different zip code, as they enter the school doors kind of thing. So while we can talk a lot about, and don't get me wrong, we need existing centers and we need family homes and all that, but we also have a large population that are not at all having any kind of a pre-K experience prior to going to school. So that's going to impact that child's ability also to, to break the cycle of poverty. So again, for a parent to work, they need early care and education for their child, but that's just as important for their child as they move forward as well. And I just kind of had to throw that out to make sure we talked about the importance to the child as well, and what the skills that they're gathering during those years. And one of the things we even have to work on in some of those early education centers is attendance, right, Deb? I mean, we've talked about that numerous times, that's as important as when you go, K through 12, attending is important to that, because every day you're learning something different.
You raised some valid points, Peg. And, I've been told by some of my coworkers at UNC that work in our child care centers, that they're not babysitters, they're educators.
Correct.
They're responsible to enforce a curriculum, to have some measures and benchmarks in place. They have some pretty standard protocol to ensure that they're having an effect on a child. And sometimes I wonder, as partner agencies, as a community, what's our role in professionalizing these positions? Are we working to further that, or are we standing in the way somehow?
Well, I would follow up with that, because they really do have, and this has been through Octel in the state, they have a rigorous role, as you would know, Lisa, in terms of the benchmarks that child has to meet, the cognitive and the developmental benchmarks. Leigh would also, all of you would know, as they move forward. And how do you kind of measure that type of assessment? Where is that? So when we talk about success by 6, you're talking about, you want that child to be prepared to learn. So it's not only the education piece, but they also have to have, as Laura said, it's a social determinant of health, and they have to have the wraparound services, which means they have a secure home and, food in their belly, and they're free of disease, and they can go to school. So it's multiple areas that impacts this. And I don't know if I'm too far off task on that. I apologize if I am.
I don't think you are. I think what you're going to tell us next, certainly the research shows that children who attend early childhood education programs are far more successful later on in life.
And you can get all the kindergarten teachers in the world, and I bet Debbie can go along with me, because we've heard this numerous times as we put together like different cooperatives. Will say, I can teach that child, I can teach them their numbers, I can teach them, I can teach them their ABCs, but they need the socialization piece of being able to stand in line, sit in a circle, and that's continually what we hear from kindergarten teachers. So that's an important piece that they learn in that early education piece.
Debbie, does your anecdotal evidence tell you that the families, that sort of cycle through your agency, the ones that are struggling to break free are the ones that aren't accessing early childhood programs?
Yeah, absolutely. And I would like to piggyback a little bit on what Peg was talking about, about the children being, on target developmentally, being assessed for any developmental delays, social, emotional delays. When they're in these centers and early learning providers, they can be referred for appropriate services. And we have a team together that we work with to look at this in our community and make sure that children are being assessed for any delays, being referred to the appropriate services, because we know that when they are they're less likely to be a victim of abuse and neglect when they're have the right services in place for any of those needs, and then they're less likely to suffer trauma that will affect them later in school as well. And also for the school readiness, like Peg was talking about, when they receive the appropriate services from being receiving these assessments, they possess the school readiness skills to achieve school success, therefore being able to be a productive member of society as they get older, whether that be, in the workforce, furthering education before the workforce. So, I think as far as, breaking the cycle of poverty, it's really important for them to be in a quality early child center, to receive these, assessments and be referred for services. And like Peg said, just the socialization, it's not just learning your ABCs when you get to kindergarten, you need to know how to behave in those programs and attend regularly, because, we see kids that, if they do suffer with any, developmental issues or academic issues, then they become truant. And of course I could go on a soapbox about that, from my standpoint, but, and then they're not going to be, as successful as they can be. So, so I think it's really important that children are in, quality care as early as they can be.
What I'm starting to hear is a lot of evidence that's needed to help parents make those decisions that we talked about earlier that they're really grappling with now. There's pros and cons, and can I save some money by keeping my kids at home or keeping them in the care of their teenage sibling. It sounds like the better decision is leaning towards childcare centers and early childhood education programs. And Laura, we might have a community effort on our hands in trying to get that education out there to help assist with those efforts. I'm going to pause for a minute to see if there's any questions in the chat that we need to address now.
Looks like folks have been saving their questions till the end. I don't see any yet, but I'm sure that they will come.
Good, then I can continue to abuse my power here and ask all the questions I want to hear. Let me come back to Leigh. High quality childcare centers like your own, are they able to sustain themselves while offering services at affordable rates for families who need it most? It's a challenge.
It definitely gets difficult, and it gets harder and harder every year. As you go on, you have to increase the rate of what you're paying your teachers in an already severely underpaid field. And as you're trying to cover those costs of those highly qualified teachers, you're trying to balance it out with increasing your tuition prices, but not to a point where you're pricing yourself out of helping the people who need it the most. One of the things that we're really blessed is we have, great partnerships with places like the United Way that are able to help us with scholarships to help those families who otherwise would not be able to afford to send their child to a quality childcare center. And those are the ones that end up in the unlicensed centers and aren't getting that education piece that they so desperately need. So it's a constant balancing act, and the cost of everything goes up. And of course, thanks to COVID, some of the basic supplies that have gone up. You're increasing the amount of cleaning supplies you're getting. You're getting some PPE now for the classrooms and the teachers and the kids. So it's just constant increasing of costs, and you get to not pass it on to the families. But it becomes more and more difficult every single year.
Ted, can you say a word about that? Have you seen additional requests?
Scholarships, et cetera, like that type of thing, Lisa, you want me to talk about?
Yeah, scholarships and United Way's role that's been.
Okay, so United Way has, and I'm going to say this, Laura, because maybe this is going to help like your women in philanthropy as they look to say, how can they invest dollars? So currently we've been doing this for at least 15 years, if not longer. So some of United Way allocatable dollars that we receive from donors every year go to scholarships at childcare centers who are partner agencies, and they would be Day Nursery, United Neighborhood Center, Scranton Y, and Carbondale Y, and those would go. And they invoice us monthly for those, and they make the determination of that child who really needs it. It may be a child who's been on the and I'm going to call it the Title 20 waiting list. I know that's not what it's called now. The CCR, the eligible waiting list, or those who just don't qualify because they're over the income guidelines or whatever. So the agency the program makes the determination, and we give them X amount of dollars, and they have to manage that so that child can have childcare for the full year. We don't fully pay for it because we do believe we still want to support the fact that the main piece is that. And what's the new way? I want to call it CCIS, but what's the new one?
Childcare Works.
Yeah, okay. So we want to support that because we don't want to do it. Once they're eligible for that, we want them to move on to that because that's sustainable for a much longer period of time than what United Way dollars are. So the family still has to kind of pay a copay. So if we're also the recipients of pre-K tax credit dollars through the state, and a lot of businesses contribute to that. We have a rather large program. So we usually can maybe do about 150 kids in 16 organizations between the two counties. That's much broader in your income guidelines. A family can make up to like over $75,000 and still qualify for that program. So what we do in the partner agencies where we've given them United Way traditional dollars, we ask them to spend that on infant and toddler dollars, and then make pre-K available through the pre-K tax credit to maximize the amount of children who we can cover, or we could cover with United Way dollars out of, after school programs as well. We're trying to mishmash that, but I just want you to know that that's already available. Like we're already doing that, and I don't know, Leigh, it kind of works, right? So we can help more kids because we have the pre-K dollars to help the pre-K kids, and the United Way dollars can go for your infants and toddlers.
Yeah, it definitely allows us to, branch it out more. So, having the families who are eligible for the pre-K one set to a specific one and allocate, the other money to those younger families, and that's the higher cost, is the toddler programs have a much higher cost than preschool, and that's because of your ratio. There's more care needed for a younger child, obviously. So it allows us kind of spread it out and assist a lot more families than if we just had the pre-K tax.
Right. And the pre-K dollars are really like that they're much more generous. We've never had that kind of generosity in terms of eligibility on that. And somebody's leaving, I'm sorry. So we've been able to really try and maximize that as much as possible. And then when we move outside our partner agencies, we look for, star 3 and star 4, because some of the businesses mandate that we do that. And we look at geographical areas that like where dollars may be needed. Like we make sure there's something in North Pocono. We make sure there's something maybe in the Mid Valley. Like, we look at partnering maybe something if we have in the Lower Valley. So we try and maximize those funds, because we understand that, children live everywhere and parents either get childcare where they live or where they work. It's kind of what happens. So we're trying and maximize those dollars. And we could have a longer conversation on that in the future if you want to know more about that. As Women in Philanthropy say, how do they, invest their dollars?
Yeah, I'm sure that, sorry, Laura.
No, I was going to say absolutely. To reiterate, Lisa, what you're saying and what Peg's saying about a broader community conversation and deeper kind of solutions-based investments. I mean, that's the goal. Begin to understand greater the barriers through this conversation, further conversations, and then try to explore solutions.
Yeah, Peg, I know that the being able to provide a scholarship to get a family into childcare center to get their kids in right away when there's a job pending has been a lifeline for the families that we serve. I'm sure Leigh, Angela can echo that. Angela talked earlier about her families, going into these entry-level positions, and I'm betting that most of them those employers aren't willing to hold that job for 4 to 8 weeks while they're working on a childcare issue.
But I'll make it clear, it's a finite amount of money. Eventually we run out, because when we give money for the year, we hope that we want that child to finish out the school year. Like we want we want them to be able. We don't want it all spent in the first 3 months, and then we want that child to have that whole year in the pre-K program or whatever it is.
It's almost leveraging assistance. It's a small amount, to access a much greater amount and have huge impact.
Yeah. But we'd be happy to partner with, work with Scranton Area Foundation, see how, we can make a bigger impact, because there's lots more need than there are resources.
Thanks, Peg. That's helpful. Angela and Debbie, while we're talking about subsidies, they reduce costs for families and facilitate that move into employment. Is there any way that they impact the quality of care that families receive, or create a stigma?
Well, I think, it has less to do with the subsidy as it does all of those other factors, like transportation, location, the work shift, the hours of operation of the center. I think all of those, as I said before, all of those things combine to factor into the quality of and the choices that families have to make. Like Linda said earlier, and especially right now, I think, with the pandemic and choices even more limited, and employment choices, more limited, I think families are really hamstrung, with some of these decisions that they have to make. And, thankfully over the years, things like the STARS program, have made inroads in higher quality childcare settings and that sort of thing. So, and that seems to be going up. Those numbers seem to be going up, but they're small. I think it was Peg who mentioned this earlier. There's still so many families and children that would be eligible that are not in that childcare system.
Mm-hmm.
Do you agree, Debbie?
Yeah, and I think what we see a lot of is the transportation is a huge barrier to our families in every aspect. But when it comes to childcare, I think that often has, and even just in talking to our caseworkers and supervisors, they often see that is, a lot of times why they choose the center that they choose. If it's somewhere close or somewhere they could easily drop off on their way to work. But I just would like to say though that when we have family meetings at times with different providers, and we have one facilitator who arranges these meetings. I'm sorry if anybody could hear my dog. My dog is right this moment whining at the door. There's nobody home to let her out, so I apologize if anybody can hear. But he'll often ask if it's a younger child who's in an early learning program. He'll ask the parents, how many stars is the program, and the parents always know. So I feel like they definitely, and I think like Linda, I think said earlier, everybody wants, the best for their child, and all our families want the best for their children, and they want them in the best program that they can be in. But, unfortunately, due to their circumstances, sometimes they have to just, based on the subsidy and the other barriers we talked about, like transportation, have to, choose the center that fits, those needs. But, they're always mindful, of the quality that their children are receiving, I think so.
Yeah, I would imagine there's a lot of families right now, making concessions, for what they have to do. And that's really, it's heartbreaking, right? Heartbreaking.
It is. And, are families asking themselves now, weighing, again, grappling with these impossible decisions, the cost of childcare, the additional unemployment benefits, does it work to their benefit right now to go back to work, or is it more beneficial to hold off?
Right.
With that being said, I'd like to just ask you all to pull out your crystal ball for a minute and answer me this if you can. Is this our next big crisis? A year ago, our biggest crisis was food with the vulnerable families we were serving. In March, it was food. In April, the food continued. Right now, it's the housing crisis. There's been a moratorium on evictions, on utility shutoffs. We're seeing that come to an end, and we're all bracing ourselves for the impact of what this has meant to families. Are we just a few months away from this being the big crisis that families, it's time and they need to go back to work in droves? We saw families leave the workforce in droves. What's coming next?
Lisa, I want to tag on to that, because what we heard on our Success by Six group is some concern also. I mean, well, you're right, there's going to definitely be a need. And some of the child cares had trouble staffing during this time because of the pay rate for what we pay child. And I want to say early education, I said that before, but what we pay them. They found maybe a different job, or whatever the reason was, they didn't feel safe going out because they had a vulnerable person at home, or whatever the reason was. There was staffing issues we had heard, but we also heard that there's great concern about how they're going to attack, what's the behavioral health and mental health of the child that's coming back.
That's right.
I think that's going to be an issue that I think it's across multiple areas, but since this is focused on early education, I would say there's a lot of concern on that.
I'm sorry. We talked earlier about the affordability, accessibility, quality issue. We call that the child care trilemma, right? And all those three dimensions interact with one another, and they compete with one another, and they need to be balanced, because typically what happens is when you focus on one of those dimensions, the other two experience negative impact. So as we look into this, what the pandemic has done basically is gone in favor of accessibility and affordability in terms of problem solving, in terms of subsidies, et cetera, but is quality sacrificed in the meantime, which has lifelong impact for the children. So I think it's a delicate balance we're in right now, and absolutely, I think it's a crisis.
Lisa, I just want to point out, I don't want to interrupt, but we have 3 panels in the chat, 3 questions in the chat. They're coming fast and furious, and I just want you to be aware, so let me know.
No, I'm glad you did. You know, you have to pull the microphone out of my hands for me to relinquish it. This is a good conversation, but let's go to those questions. I know there's people that have some input here. So Catherine Halden is commenting, obviously there's a need for greater intervention for childcare that is available for non-traditional hours. Perhaps there needs to be an investment by the business community who employ workers in non-traditional hours. Good point. Laura, that might have to get added to the, something to explore as part of a larger community initiative to do some outreach.
Absolutely, and I think there are some models for that. You know, we see them sometimes coming across that there's some conversations on that. So that's definitely a point of exploration.
Agreed. Kelly Langan is asking, Linda mentioned a rise in more extreme behaviors in the past few years. What kind of impact does a child's behavior have on their access to quality childcare, and how can we do better at supporting families with children who exhibit these behaviors?
Well, I think as we referred to, the teacher, it's a difficult situation to have those behaviors within the classroom setting, right? Because you're dealing with some, the safety issues, and you're dealing with attending to the children who are not experiencing the issues as well. So it's kind of like, trying to be at all places at once. The child, I think now, so therefore, I mean, we do have regulations in terms of not expelling children for their behaviors, et cetera, for sure. But it's also important that we have family involvement in all of that. So that whatever intervention, whatever supports, whatever program that we come up with is always also carried over into the home. And, now especially it's more challenging to do that because of all of the things that people have to take care of now, outside the home, and finding time to do that is critical. So I think that the families, the more we can help them with parenting, with prevention, support to their questions early on, is going to help, help that whole piece, we hope. Because again, our community is also not so rich anymore in terms of resources for young children in that situation, which is why we've had to bring in some, build up our in-house capacity to deal with those kinds of behaviors. It's the dollars that aren't there, I'm sorry.
Oh, I'm sorry. I will tell you that this is something that's been talked about in the Success by Six group for a number of years, is, and it may be that the pediatrician is reluctant to make a suggestion that the child has, a delay or has an issue. The child care person, the early education, meets with mom, says, I think you need to do something, or mom and dad. And, they go to the doctor, and the doctor's like, oh, well, maybe Johnny will outgrow it. We've talked about this numerous times. And then, finally get the referral, and it has, over to early intervention. So I know that there's been a lot more work done with the county and systems of care on that, right, Deb? I mean, in terms of trying to streamline that process, and, educate docs and educate families on that this is like a really good thing, because it's really preventive, and it's not a, it's not a bad thing, because maybe you can take care of those issues. Maybe a physical issue, it could, could be a behavioral issue, and maybe you can take care of that before the child is really ready to learn. What Debbie talked about earlier, anything that we can take care of in that early education before the kid goes to school that helps them learn earlier and helps them get through that issue, is a huge benefit to that child as they go through school.
And so, I'm sorry, go ahead.
No, go ahead, Linda.
Oh, no, I was just going to say real quickly that many of the children, we're trying very hard to become a trauma-informed agency, right? So we are working with the families as well, with the staff, with the children. And what we're seeing too, in terms of children that are experiencing trauma, I mean, for heaven's sakes, we've had children, 2-3 years old that are dealing with very severe issues. And it's the trigger of, that's really happens within the classroom setting sometimes. So it's critical that, I think, like you say, that we deal with that very, very early, so that those children are able to interact in the classroom setting in positive ways and develop those social skills that are going to make them successful as they go forward.
And anything that we could do to support a lot of those, like the ages and stages, and then, ACEs score and all that kind of, like, those are all things that are really important, to work with pediatricians and to work with organizations to understand that. So we worked prior to COVID. There was a lot more being done on those kinds of trainings, and I mean, obviously, there's a lot of training that has to be mandated on the state level as well. But I mean, I think there's lots of areas you guys can go in women in philanthropy, because there's lots of issues and there's lots of, things that can be done to ensure that, all kids at least have what we want is that all kids have an equal shot as they go through life.
Yeah. And I just think a little bit, Peg, of what I just want to emphasize it a little bit more, because I think it's important what you were saying earlier, but I think it was you saying about, the mental health coming out of this pandemic. We're seeing younger and younger and younger kids, and more of them having to be hospitalized, going in for evaluations for possible hospitalization. And I think these children going into, early education centers or into our schools, it's already been a year that they've lost, structure a lot of the time. And we're just seeing a lot of more mental health younger and younger. So, that's definitely going to impact as they're, coming back into the centers and the schools.
Angela, your turn.
I'll just add, I'll make a shameless plug for our programs, but, to address Kelly's question, I think, that's when also evidence-based, high quality home visiting programs like Early Head Start, like Parents as Teachers, like Safe Care Augmented come into play. They can work with families one-on-one in addition to the, work that their children are doing at a child care center or an early learning center, I should say. And also something like the Incredible Years, which is another evidence-based classroom program for parents. Those programs can really, help parents address their child's difficult behaviors in the home and, have an impact in an early learning setting too.
And so many times parents are just desperate for that kind of information and support.
Absolutely.
Yeah.
We hear all the time from parents, like, I wish I took this class sooner. I'm learning so much. We hear
No doubt.
Yeah.
Kelly, I'm hearing that's a real struggle, but let's exhaust all of these options when you're faced with that. There's another question from Nora Kern. She's asking, when childcare centers receive lower star ratings, is that generally due to funding or other issues? And that's open to anyone.
Lisa, you could probably answer that one.
It's due to a number of issues, and funding could play a role. There's certain assessments that the state has to do to determine your star rating, and part of that is your environment. And if the environment requires lots of repairs or aesthetic touches, there's money needed to do that. And there's also requirements with the staffing, degreed staff, which means the salaries have to be a little higher. So a lot of things come into place, and there could be other issues. If an agency is not reaching all of those stars, it could be that they're falling short in one or more of those areas. If no one wants to add to that, I'll go to the next question. Maggie Martinelli is asking, how do we change the stigma or mindset from childcare to early childhood education?
I'll start there because I was the one who started this, and then I used childcare. So it all starts individually with ourselves, I would say, because that's the word, that, you've been in the field for so long, but it's a conscious decision to say that these programs are early childhood education and they need to be respected as that. But that's the continuum of education for your child. As you said, Lisa, it's not just a babysitting service. It's not just a drop in, hello, can I come tomorrow kind of thing. I mean, there's a process and your license and how many kids can you have. And, when somebody calls me because they need care, I always say to them, I can give you this information, but doesn't mean that they're going to have an opening for the age child. I need an opening for a toddler and I need an opening for a preschooler. Maybe they don't have those openings. But I really think, I think that's a community piece that we all need to own, to say that we have to really look at this as it's early childhood education.
Peg, you're right. It sounds like it's a cultural change. It went from, at least we got away from calling it daycare, recognizing that nobody's taking care of days, they're taking care of children, but it's beyond care, it's educating. Right. So let's move in that direction and get it right. And I want to be respectful of everybody's time, and we're coming up on 6 o'clock. Laura, I don't know if you wanted to close us out. I'm sure we've got some next steps to go back and work on.
Absolutely. I want to say one of the important things is just in our terminology, we've got to really be cognizant on the part of Women in Philanthropy and the Scranton Area Foundation, make sure we're using the correct terminology when we're talking about this issue and challenge in the community. So I thank the panel for highlighting that. I will also say, wow, what a great panel, what an excellent, engaging discussion. We greatly appreciate your time, your work, your expertise, and your insight. Thank you to Lisa Durkin for being a fantastic, fabulous moderator for this panel. Really appreciate it. It's recorded, so I know I'm going to watch it again, and I'm sure many other people in Women in Philanthropy and in general will be watching it. And to everyone on the webinar, thank you for joining us tonight. This was the first of 2 webinars that will be focused on childcare, early childhood education. Hopefully, like Lisa said, like Peg said, like laying the groundwork for potential community-wide focus on affordable, accessible, quality early childhood education. The first sessions of each panel obviously are laying the groundwork, and then the follow-up webinar is to kind of explore these solution-focused models and highlight what that was brought up tonight could be the focus as we move forward. And just kind of to reiterate, there are 6 total panel discussions in the Learning to Break Barriers series. These themes that we're focusing on were all selected by Women in Philanthropy supporters. They're themes that exist for exploration in addition to what we're already working on in areas of entrepreneurship, matched and shared savings, STEAM education, healthcare and transportation, and dental care. And I heard transportation mentioned several times tonight. So I think it's important that we keep connecting transportation's impact on so many of these critical areas. We're looking forward to everyone's continued engagement as we look to enhance the voices of women and girls throughout our region. And we hope that everyone continues to join us on these important webinars. Thank you again to a fantastic panel and moderator. And thank you to everyone for your support of Women in Philanthropy. And thanks for joining us on a relatively nice weather this evening. So we appreciate it. Thanks again, and we look forward to continuing this conversation.
Thanks for having us.
Good night. Thank you.
For having
you.
us.
Good night.
Thank you.
Nice to be with you all.
You too. Thank you very much.